Hey, what's going on, guys? Today we are talking about something that I really think can help a lot of women that are on any sort of contraceptive, and women in specific that are on these contraceptives and having issues with potentially depression, low sex drive, retaining water, uh, low density muscle mass, and various issues such as that, right? So when we talk about this, I'm going to explain how exactly we fix this issue, but I need to set I need to paint the picture as to what exactly is going on in terms of hormones in the body first, right? So real quick, when we talk about this, I will say a couple of the biggest culprits of causing these issues, these negative satellite interactions in the body, is going to be things such as the Depo-Provera shot, such as most all orally ingested. Uh, or I should say any type of honestly any type of orally administered birth control, and then also any sort of Nexplanon or Implanon that is in your arm right here, right? So all of these drugs have something in common, right? And that is that they are hormones that are inserted into the body somewhere else, and they have to essentially travel to the reproductive organs, right? So they're not locally administered. And so what happens then is that these drugs negatively interact with the rest of the body because they have to interact in order to get down there, right? So what happens then is you have this ethinyl estradiol, the physiological doses of progesterone in the body that can cause a lot of negative consequences in turn, and that's exactly the progesterone in particular definitely causes women to retain water and have issues such as the low sex drive, et cetera, et cetera. I could go on and on for days, but that progesterone is actually typically what happens when you become pregnant and your body says, oh, I'm pregnant, and so your body immediately goes into survival mode, trying to build up these fat stores for what it perceives to be a baby coming, right? So we have this issue. So how do we fix this issue, right? And I'm going to tell you. So what we have found clinically in a lot of cases that has really helped women in terms of having these issues is ingesting what is called DHEA, and what that stands for is dehydroepiandrosterone. And so what dehydroepiandrosterone is it is essentially a precursor to testosterone, right? So the biochemical pathways of testosterone are relatively complex. I've broke it down in another video, but what you have is you have this dehydroepiandrosterone, and what you get out of that is it goes through another metamorphosis step, and it uh, it goes through a receptor, and then it becomes true testosterone. And so this testosterone is actually needed in women. And you might think, oh, I'm a girl, I don't need testosterone. That's what guys have. Well, uh, I'm going to slow you down right there. I'm going to tell you, women need testosterone, and guys need estrogen. Actually, fun fact: male appendages actually won't work if men's estrogen levels are absolutely crushed. And likewise, women won't really have a sex drive at all, and they may have some sort of pain or significant discomfort during intercourse if they have very low testosterone levels. And so the typical levels, the ideal levels, I should say, in a female are around 70 nanograms per deciliter of testosterone, right? So that's very low. But when you go on some sort of a progesterone or an estradiol with a progestin, and there's other chemicals in there, but when you go on those chemicals, what you then have is you have almost a complete crush of testosterone. I mean, women are being, blood tests are saying anywhere from 10 to maybe 20 nanograms per deciliter of total testosterone in the system. That's total testosterone. That's not free test. That's not free flowing test. And some of that testosterone is being, bound up into sex hormone binding globulin and albumin and other things, and et cetera, et cetera. But the point is, before I get down the rabbit hole too far, the point is that you can't even use all of that test that is currently crushed. So you're gonna have, what do you think of when you think men that have a lot of testosterone? You think lean muscle mass, you think high sex drive, you think good mood and cognition, and you're absolutely right. And so what we're trying to do is this we're trying to insert this precursor to testosterone because the current biochemical pathways of the progesterone and the phenylestradiol are saying, hey, we don't need this testosterone right now. And actually, you do because you're not actually, you know, making a baby at the moment. You're actually trying to avoid having a baby, is what you're doing. But, you know, so we take in this DHEA and the body says, oh, I can convert this into testosterone. And that's exactly what you're doing, right? And so in a lot of clinical situations, this DHEA has brought women's testosterone back up close to, if not even at its normal baseline, which is roughly 70 nanograms per deciliter. Obviously, some higher, some lower. Everyone's genetically predispositioned to something different. But the point is that using this DHEA will restore very close to, potentially very close to testosterone back to baseline. And also, the great thing about it is it doesn't impede the efficacy of birth control as far as we know currently. Okay, so when you ingest this, this is working through a slightly different biochemical pathway than this progesterone and this phenylestradiol is and these various other chemicals, which is really good, right? So you're getting these benefits, and honestly, a couple of satellite interactions with some of these nerve cells and these surface receptors in the nerves and areas like that, and you're able to get some of that good cognition. You're able to get that lean tissue, that muscle mass, and everything else that you're looking for, and you just look good. And I do want to tell you guys, this is not like as soon as you get a little bit of testosterone back in your system, this is not like you are just all of a sudden gonna just blow up and look like the Hulk. I mean, this is just not the case. Women are genetically predispositioned to a much lower amount of testosterone. I will say, guys, a male is considered hypogonadal, which means that he is simply not producing enough endogenous testosterone at 200 nanograms per deciliter. I mean, that would be like a female going on a cycle of testosterone, right? I mean, that is a big, big jump, right? So there's a massive difference between a male that is considered to even have a disorder with his testosterone and the highest level that a female has, right? So, and this DHEA is just going to bring you back up and optimize your system. It's no more than like maybe a test booster from GNC, and I do have another video if you're curious on those. But I digress. The point is that this DHEA not only will help women that are on contraceptive, it will also help women. It will increase fertility in women we have seen that are not on any sort of contraceptive, and it will also give them a higher sexual appetite and increase muscle mass and cognition and all those good things. So honestly, it seems like a very, very promising thing to potentially do. And there's a bunch of different, potentially different forms of birth control that you're on. What I would say the best decision from here would be is to, contact your physician, because obviously you should contact your physician before you administrate anything into your body. And they're going to be able to tell you a little bit more of, is DHEA an efficacious option for you to potentially ward off these negative side effects that you're experiencing from these oral contraceptives. I do want to say real quick, so these locally administered ones, you're not going to have as many issues with those. You may have some, but you're not going to have as many. So just keep that in mind. And again, like I said, just talk to your care physician about this specific matter, and good luck with it.